The Roswell Park model of care is really based on multidisciplinary care. And multidisciplinary care may be provider-based, in other words, radiation oncologist, surgical oncologist, medical oncologist, but it's also all the other stuff that goes into it. Because we're under one roof, we have a lot of services that are available to the patient with a single visit, for example, nutritional support, psychologic support, we have physical therapy here. So all of those things that tend to get fragmented in a outside care model in a cancer center environment are all brought together in an integrated fashion. So I'd say one thing that we have that really distinguishes us and what we're very proud of is that multidisciplinary integrated care where a patient can come here, we establish what the problem is, and we can find a way of dealing with that problem. The multidisciplinary care model and the integrated care model is really beneficial, I think, for referring physicians in the sense that they know that they can refer their patients to one place and get all of these elements of care, cancer care, any psychological support, case management, social work, physical therapy, nutrition, rather than having to make 6 or 7 referrals to different places in the community. They know that all of those patient needs can be handled in one location. Physicians that refer us patients may be their primary physician, it may be a subspecialist, it may be a diagnostic specialty like gastroenterology or pulmonary medicine, but nonetheless, many of these physicians want to be part of that care that the patient is going to receive during their cancer. Some may not. Some may just say, you know, you're the expert, we want you to take care of the patient. Keep us informed of what's going on. So first thing we have to do is communicate and understand what the expectations of the referring physician are. Do they want to be part of the care team? Do they want to be intimately involved in their patient's care, which is fine, it's helpful? Or do they want to just let us go ahead and manage the cancer problem, and then if there's any other problems, then we can go back to them. So communicating and understanding how involved they want to be is really important. We have a number of tools that our referring physicians can access. We have our partners in practice. We have a mobile RPMD app. We have ways for referring patients both by telephone and online. So we're trying to meet the needs of referring physicians to make it easy for them to refer patients. And then we also try our best to communicate back to them with prompt documentation to let them know what's happening with their patient. And we're always free. Most of our physicians will be more than happy to take calls from referring physicians. Many of them will give their cell phone numbers out and to try to encourage that, because the communication just helps the patient care. We completely recognize that the better the healthcare providers communicate, gets rid of the fragmentation that we oftentimes see, and ultimately the patients and their care is better for it.